The gentleman from Illinois, Mr. Krishnamoorthi, is recognized for 5 minutes.
Thank you, Madam Chair. Dr. Kumar, would you like to answer the question?
Thank you. Yes. So I was going to say that I find it bewildering, and actually I'm flabbergasted at the fact that we have 17 states with abortion bans. I'm here to talk about what's going on in Texas, and I was very surprised to hear a question about Margaret Sanger. I also want to say that at Planned Parenthood, we do not stand for racism. We're happy to serve our clients that are black and brown, and we're actually proud to do that.
Thank you, Dr. Kumar. I just want to turn your attention to this 15-week nationwide abortion ban, which Senator Lindsey Graham first talked about. But it turns out on June 24th of this year, Mr. McCarthy, the House Minority Leader, actually said he supported that. So this is not some kind of an abstract concept. It's very clear that if Mr. McCarthy were to somehow become Speaker of the House, he would put the 15-week abortion ban on the floor, and it would likely pass if it had a majority of Republicans supporting it, which it currently does. Here's my question, which is this nationwide abortion ban, 15-week nationwide abortion ban, Dr. Kumar, a 2021 study predicted a 21% increase in pregnancy-related deaths if an abortion ban were imposed, with black women facing a predicted increase of 33%. Can you explain to us why there would be an increase in pregnancy-related deaths, as well as more black women, a 33% increase in black women dying as well?
Sure. Thank you for that question. What I would point to first is a recent CDC report that looked at maternal mortality in our country and actually found that 4 out of 5 of those deaths are preventable. Some of the top conditions that they talked about were mental health conditions such as suicidality or depression, excessive bleeding referred to as hemorrhage, cardiac conditions, which are highest among black women, and also hypertension-related conditions. All of these things are preventable. When we look at today's landscape of abortion access and we talk about a 15-week ban, we can look at Florida, for example, what's happening today with a natural disaster, Hurricane Ian. As that state has a 15-week ban, and we think about what's happening to families, what's happening to their homes, folks that may be 13 weeks pregnant or even 10 weeks pregnant, as they deal with the things that they're having to deal with in their life, they're being pushed further and further into pregnancy. When we look at the landscape around accessing abortion and the limited number of clinics that are still available in Haven states and how long people are waiting, sometimes several weeks, that's also pushing them further into pregnancy. So these impacts are always felt disproportionately by people of color, especially low-income folks and also black folks. And that's what we'll continue to see, but it will only worsen from here.
So basically what I'm hearing you say is that if you have this 15-week abortion ban, and you have all these people who already are lacking maternal health care and, of course, access to reproductive health care, that they're likely going to go past that 15-week mark, and then they get pushed into pregnancy, whether or not they like it. Now, walk us through why that results in death.
Yeah, that's a great question, and I think we can look to the Turnaway study where what we find, and the Turnaway study looked at folks that were able to access an abortion and compared them to folks that weren't able to access an abortion, which is exactly what you're looking at. And these folks had less access to prenatal care. We found that they had worse outcomes, including things like eclampsia, and in the study also 2 women died in the group that were denied access to abortion. We also saw worse outcomes for the children that they were forced to have, as well as the children that they had at home. So these impacts are faced by the people that are denied abortion care, that are not able to get the care, as well as the children that they're being forced to have, and it causes generational harm.
Tell us about the children that are born in those situations. Tell us about their health as they kind of emerge into the world.
Yep. So again, from this study, they showed that the folks that were denied abortion access had lower birth weight children, and that there was poor maternal bonding. And it's understandable as people are making decisions about their pregnancies and what to do in their lives, know that they can't be pregnant, and when they're denied that care, it's difficult for them to come up suddenly with a means to stay pregnant, to parent children appropriately, and have the resources. The other thing I would mention is that states that are most restrictive with abortion access also tend to be the states that lack appropriate maternal care.
Dr. Verma, I want to ask you a question. Sometimes my colleagues like to create this exception for life of the mother, not health of the mother. And you've probably heard of this particular exception. I guess tell us a little bit about what that practically means for a physician who is then forced to decide whether the life of the mother is in jeopardy as opposed to trying to save the person's health, and whether this person escalates to a point where their life becomes endangered and they die.
Your time has expired, but she may answer the question.
Thank you for that question. It's often unclear to us as doctors who are practicing on the ground what these exceptions mean, when we can actually intervene and take care of the person in front of us. How sick is sick enough? How much bleeding is too much bleeding? And it's completely counterintuitive to us in our training as doctors to have to wait for someone to get sicker before we can actually take care of them. I do just want to point out, as a doctor, we practice in these really complex environments. Medicine, people's lives, health are complex, and we do a disservice to our patients by trying to put things into neat little boxes or narrow definitions, as we've heard politicians try to do today. That's just not how medicine works.
Your time has expired.